Hey everyone, today I'll be talking about anatomy of axillary artery in brief. Axillary artery is continuation of subclavian artery. It extends from the outer border of the first rib to the lower border of the teres major muscle, after which it continues as the brachial artery. The pectoralis minor muscle divides the axillary artery into three parts. The first part is the superior, or say proximal to the muscle. The second part is posterior, or say deep to the muscle. And the third part is inferior, or say distal to the muscle. Some relations of axillary artery are as follows. The first part is related anteriorly to the skin, the superficial fascia, the platysma, the supraclavicular nerve, the deep fascia, the pectoralis major, and the clavipectoral fascia. Posteriorly, the first part of axillary artery is related to the first intercostal space, the serratus anterior muscle, and the medial cord of the brachial plexus. Laterally, the first part of axillary artery is related to the lateral and the posterior cords of the brachial plexus. And medially, the first part of axillary artery is related to the axillary vein. The second part of axillary artery is related anteriorly to the skin, the superficial fascia, the deep fascia, the pectoralis major, and the pectoralis minor muscle. Posteriorly, the second part of axillary artery is related to the posterior cord of the brachial plexus and to the subscapularis. Laterally, the second part of axillary artery is related to the lateral cord of the brachial plexus and coracobrachialis. Medially, the second part of axillary artery is related to the axillary vein and the medial cord of the brachial plexus. The third part of axillary artery is related anteriorly to the skin, the superficial fascia, and the deep fascia. Also, in upper part, there are pectoralis major and the medial root of median nerve. Posteriorly, the third part of axillary artery is related to the radial nerves. Also, the third part is related posteriorly to the axillary nerve and the subscapularis in the upper part and tendons of latissimus dorsi and teres major in the lower part. Laterally, the third part of axillary artery is related to coracobrachialis. Also, the third part of axillary artery is laterally related to the musculocutaneous nerve in the upper part and also the lateral root of median nerve in the upper part. Along with this, it is also related laterally to the trunk of median nerve in the lower part. Medially, the third part of axillary artery is related to the axillary vein. The first part of the axillary artery gives a branch known as the superior thoracic artery. The superior thoracic artery supplies the two pectoral muscles and the thoracic wall. The second part of axillary artery gives two branches. The first is the thoracoacromial artery. Thoracoacromial artery gives four terminal branches. The first terminal branch is the pectoral branch, which supplies the pectoral muscle. The second terminal branch is the deltoid branch. The third terminal branch is the acromial branch. And the fourth terminal branch is the clavicular branch, which supplies the acromioclavicular joint and the subclavius. The second branch from the second part of axillary artery is the lateral thoracic artery. The third part of axillary artery gives anterior and posterior circumflex humeral artery. The third part also gives a branch known as the subscapular artery. The subscapular artery supplies the latissimus dorsi and the serratus anterior muscle. So this was all about anatomy of axillary artery in brief. Here is the overview of what I have discussed. If you think this video was helpful, do like this video, share this video and subscribe to my channel. Thank you.